As of 9 June 2020, the cumulative world case count of COVID has recorded over 7.2 million people infected, and just over 410,000 have lost their lives, thus giving a fatality rate of 6%. Before we move on to the seventh webinar today, I will be very brief to recap all major observations made in the past 6 webinars conducted in the past 6 weeks by 23 speakers of global stature and global work, and those webinars were watched live by over 250,000 viewers and close to 500,000 who left their footprints on the platforms. The webinar 1 was titled Epidemiology and Its Trajectory. The WHO speaker recommended to expand COVID testing to maximum possible by all countries. The director, dean of Congo University reminded that African countries were months behind in the epidemic, needed to expand on testing labs and funding required for control in African countries. The US speaker, she showed how to reduce the speed of spread of COVID by bringing the formula RO and suggesting how to bring it below 1 so that the epidemic starts dying down. The webinar 2, entitled Country Preparedness and Responses, the senior Chinese government speaker, he shared Wuhan lessons of country shutdown for 70 days and subsequent opening up with the use of masks, hand hygiene, and elderly protection and physical distancing by the populations. There were no cases of relapse or reinfection that occurred in China. The Indian IITN statistician showed crowding as one of the high risks and recommended high COVID prevalence zones to be restricted from travel and trade activities for some time to come. Webinar 3, titled Diagnostics and Testing, the Indian member of the upper house called Rajya Sabha and the member Honorable Sahasrabudheji, he listed the Indian government's priority of saving human lives at the cost of even short-term economic losses and promoting local entrepreneurship to prevent stockouts of essential commodities. Cambodia benefited from early closure of international borders, hence it had 143 cases with only 4 deaths so far. India's blood testing for COVID is in full force. Lockdown and quarantine were most effective strategies as suggested by the speakers. Webinar 4, entitled Treatment and Vaccines, India developed treatment protocols early on, and India's hydroxychloroquine is being debated globally presently for its use, but convalescent plasma therapy is useful. Vaccine efforts are on for 85 candidate vaccines and likely to take 12 to 18 months to find the effective vaccines. Webinar 5, entitled Personal and Institutional Prevention and Protection. Italy is going through a severe epidemic and high deaths just like the United States of America due to the late and partial lockdown. Elderly population over 75 years are not admitted in the hospitals due to severe bed shortages, but they are provided home-based care in Italy. Proper use of face mask, even homemade cotton masks, whenever people are venturing out of homes has benefited Japan immensely. India enforced the mask late by 2 months on insistence of the Indian Prime Minister. India is making PCR and rapid testing kits and 250,000 PPE suits daily. Reopening schools is the last priority to ensure safety of children. Ayush products are recommended for prophylaxis against COVID. Initial finding of homeopathy prophylaxis is found encouraging. For example, Pune police has a prevalence of COVID positivity of 0.3% after they have already taken homeopathy prophylaxis compared to Mumbai police having COVID positive prevalence of 2.8% in the last 3 months because of low use of the same homeopathy prophylaxis. So, the last webinar, the sixth one on socio and economic impact of COVID-19, there were varied socioeconomic impacts designed and discussed, seen in countries that declared a variety of lockdown restrictions that were graded as light or moderate or severe forms of lockdown restrictions. Various grades of socioeconomic effects were described, including gross human rights violation on women, refugees, and children. Many rural areas are as densely populated as the urban areas. It was suggested that tapping into the potential of the migrant workers and to view them as entrepreneurs and storehouses of talent as they relocate back to their hometowns and villages is a good priority. Skilling and reskilling migrant workers and linking migrant enterprises to e-marketplaces is another priority. There is urgent need for scale up in counseling services for lonely patients or families with COVID and accelerate community participation as a priority intervention. For the seventh webinar today, it is titled COVID-19, Mental Health and the Economy, Making Sense of a New Normal. Our first speaker is Dr. Nimish Purohit, a practicing psychiatrist and assistant clinical professor of psychiatry at McMaster University in Toronto, Canada. He's seen a host of mental issues and emerge as a result of COVID among sections of communities. Since the audience watching this webinar today live on the Facebook, LinkedIn, and Twitter platforms has exceeded 52,000 last week, it speaks of tremendous community needs for knowledge. Please let the questions come in, since we will be having question answer sessions towards the end of each lecture. I have borrowed the economic impact of COVID slide from International Monetary Fund. The slide shows IMF estimates in April 2020 of real GDP of major countries between 2019 and 2020 to show the effect of COVID pandemic. Now, the first country that it shows is United States of America, with its GDP in 2019 at 2.3, which is likely to fall to minus 5.9 in 2020, thereby giving a GDP fall to the level of 1/4. The next one is the European Union collectively will lose the GDP to 1/7 by the end of 2020. Japan will lose to 1/8, China to lose to 1/5 of its earlier GDP, while Indian GDP in 2019 was 4.2% and would likely drop to 1.9% by end of 2020, thereby effectively reducing the GDP to 1/2. This is despite the fact that India to go for a national lockdown to save as many lives as possible, even at the cost of economic losses that were anticipated due to these lockdowns and shutdowns. A country like Russia is likely to reduce its real GDP by end of 2020 to one-fifth of 2019. Similarly, Brazil to one-sixth, Saudi Arabia to one-ninth, and South Africa would go down to lose to one-fifth to 1/25th of its GDP as compared to 2019. So, with all this background, it is important for us to now look at the economic impact and hear what is happening in the economies of several countries in Asia and Africa. And we have the next speaker, Mr. Karan Bhasin, who's an economist and policy researcher and also director of Global Young Action Network Foundation, India. So it is up to you, Mr. Bhasin.
Thanks to Sambodhi, ISRN, and University of Washington for taking this initiative. Uh, so one of the key issues that I want to begin with is exactly what is it that we are dealing with right now. Because there's a lot of focus on the impact on GDP, impact on livelihoods, impact on income, etc. Uh, but it's also important to recognize what is it that exactly is the nature of the problem. So the slide that you shared was estimates that were during the World Economic Outlook, when IMF came out with it, and a lot has changed since then because just yesterday World Bank came and said that this is going to be the worst global recession compared to the World War II, and I think within the last month, a lot of unknown unknowns have become known, but there is still a lot of uncertainty regarding what is likely to follow. And what happens in such an uncertain period is it is very difficult to accurately predict what is going on. Uh, so the best that we can do is to sort of put in place an analytical framework to understand what exactly is happening. Now, this pandemic has two dimensions to it. One is the public health dimension, and the other is, of course, the economic dimension to it. I would actually like to share my screen to give a sense of idea, of exactly what is it that represents this trade-off. So this is basically a scatter plot that shows number of government social distancing measures and the number of cases. And what this makes very clear is that the more social distancing measures that have been taken by countries, the number of cases on an average has been lower, which means that, of course, social distancing has worked. And what it also means is that when you impose social distancing measures, such as not allowing more than, say, 10 people to be in a crowded space, etc., it has an impact on contact services. And contact services basically means your restaurant, hospitality, and industries such as that. uh, so of course this pandemic is going to have a disproportionate effect on certain sectors of the global economy, such as aviation, as we are now seeing, whereas relatively safer sectors could be agriculture, etc. And that is true even for India, because we see that agricultural sector has not been very adversely affected. So this trade-off is something that we need to keep in mind, that if you want to save lives, then we need to put in place social distancing measures, and they obviously come with a certain degree of cost. Now the next thing that I want to talk about is China, because this entire crisis originated from Wuhan, and China was one of the first countries to go for a lockdown, and obviously it sort of did face certain costs associated to it. So when we look at China, we see a very swift V-shaped recovery in economic activity, which is very encouraging because a lot of the focus that all of us have had over the last couple of months is to basically put exactly the growth trajectory. That what is going to happen once the lockdown is lifted across countries, what is going to happen when the fear of the pandemic is going to subside, because we don't see a vaccine coming in till sometime next year, and that means that this virus is something that we have to stay with for a while longer, and we obviously cannot keep our economy shut. So this graph basically presents exactly what kind of recovery we are looking at. It is going to be a very swift recovery, and this data is also sort of corroborated by the China PMI numbers and US initial claims data, which basically represents the joblessness. A key point about this statistic is that in history of this data set, US never experienced such a sharp increase ever as it did in the pandemic, and that represents the scale of the economic disruption that this has caused. And now that the situation is also drastically improving, it again signals a very swift recovery. But this scale of disruption is important for emerging market economies such as India, Brazil, Argentina, and of course, even some Asian and African economies. One of the key things that we need to recognize is that the world is not fair, and the way the economic system is, obviously, so there are certain privileges that the early industrialized countries have that are not available to the global south. Say for instance, countries like US, UK have gone ahead and given record high stimulus packages to absorb any form of economic shock from their companies. Now that's a privilege that economies like say Argentina, etc., cannot afford, because the moment they start doing that, there are concerns, and I'll come into those concerns in a bit, because they're very relevant for countries like India and certain African countries as well. So that differentiating factor is something that we need to keep in mind. But before that, I want to talk about lockdown, because there's this entire debate happening that, and this is very true for the Indian context, where people are saying that there's no demand, and that you need to give a demand-driven stimulus, you need to do cash transfers, etc. Some of which government has already done as a part of the 20 trillion package. But this is what I want to discuss. Lockdown means that there is no economic activity happening, and that essentially means that there is no market operating. And when there's no market, you don't know whether there's demand or supply. So we cannot make any prediction about whether there's demand which is missing or not, unless and until obviously we lift the lockdown. And of course, lifting the lockdown means taking a risk in terms of increased cases. So that's the trade-off that government face. But of course, every day of lockdown has a cost associated with it, and we should be well aware of these facts, because at some point people are going to ask that why is it that your economy hasn't done well, or why is it that your GDP has contracted, because as of today India is also likely to register negative growth. And of course we'll register negative growth, but it won't be as bad as some of the other countries, so we'll still be relatively much better off. But the reason why we'll get a negative growth is because now it's been over a particular, over an entire financial quarter where there hasn't been economic activity in nearly 60% of your economy. And when that happens, you obviously cannot expect any form of growth to happen. So that's something that we do need to keep in mind. So I'll just stop the share over here, and I'll now have a more nuanced discussion regarding the nature of the problem. You see, when the pandemic comes in, there's a lot of uncertainty, and when there's a lockdown, what happens is that companies continue to face fixed costs, and these fixed costs come in the form of rent, wages, etc. Now, in the event of a lockdown, company does not undertake any economic activity, so there's no revenue coming in, but there's a cash outflow going on. And this is a cash flow problem. This is primarily a cash flow problem that companies are facing across the world. And this is not just in the context of lockdowns. Economies in Africa, etc., where there hasn't been a lockdown, they're also facing this problem because of uncertainty and supply chains being disrupted. Mind you, a lot of the supply chains go back to China, and China is the de facto manufacturing place of the world. So when China was in a lockdown, the global supply chains kind of broke down, and companies had no idea of how to repair them immediately, because there were no alternatives readily available. So all of those factors have put in place a significant cost on companies across the world. And some of the economies have tried to absorb this problem. For instance, if we talk about India, India announced a stimulus package which had tax deferrals, easy credit to MSMEs, and at the same time, it also looked at equity infusion in companies. Now, this was done to ensure that companies are able to get enough cash into themselves so that they can sustain their operations. And once the economy is back on track, they can, make use of this opportunity which has presented itself to India. And I think a lot of countries are trying to do that, and that's good, because it will ensure that a major part of the crisis can be addressed upfront, and that the costs are limited onto the companies. But of course, for countries such as Argentina, this is not possible because they have a significant debt problem. They can't. I mean, Argentina has been running a deficit. They have a lot of debt which is owed to foreign players, and they want their money back, and they are unable to arrive at a sort of conclusive solution to the problem. So this entire pandemic, which results in lower economic activity and stress on the corporate sector, or companies, this can spill over to the financial sector, and in certain places it has. And once it spreads in the financial system, it becomes a contagion, because once there are bankruptcies, you see a lot of financial system stress which keeps coming up. India is well aware of these stresses, because we have been facing a financial crisis in the form of NPAs since 2012, 2013. So the entire financial system will at some point take this stress on, and this will create a major problem for economies in Southeast Asia and in Africa, because you'll see currency movements happening. We have already seen the dollar becoming a much more stronger currency, relatively appreciating, and that has happened because whenever there's a crisis, people generally tend to move towards safer assets, and that is dollar. So there's shortage of dollar in the international market, which is affecting emerging market economies and making them more vulnerable. And at the same time, the development finance which was available in the form of sovereign funds, etc., for investment in a lot of these countries, such as South African or even India. Now that capital is not going to be available, which means that the cost of capital is going to go up. So while of course there are multilateral agencies that will provide aid, such as World Bank, which has already provided aid, and IMF, which has also sanctioned a lot of money to low income countries, but the fact is that private investment in these areas will be hit severely, and this means that for the next 6 to 8 months we are looking at low levels of capital inflows in emerging market economies. India so far has tried to avoid that trend, and a major reason is that because it included economic reforms as a part of its stimulus package, which no other country has, and those reforms gave the confidence to foreign investors to put in their money in these uncertain times, and that is why we've witnessed a relatively comfortable position. But for other countries, countries such as, say, Vietnam or Bangladesh, or Cambodia, that will be very difficult. And with this large pool of global capital lying, with so much of liquidity lying around the global financial system, and it not being available to these countries, this will definitely dampen the process of their growth. And a major blow would be that we will see a sharp increase in global poverty levels for the next couple of months, after which situation will normalize, and of course we'll be back to the pre-COVID situation. So the next 6 months are obviously going to be very difficult for a lot of these economies, uh, and there will be a lot of volatility. Uh, but the key concern that I have at this moment is to do with protectionism, which has resurfaced, because every country wants to protect its own interests, specifically with respect to China. We see countries try to move their supply chains away from there, and companies are also eager to not rely on them too much, because they've realized that when you rely or when you over depend on a particular country, it brings in a different kind of risk to your supply chain. uh, so that's also happening. Now the problem is that in the event that we do turn towards protectionism, and if there are tariffs which are raised across all countries, which means that you do not isolate particular countries, but you raise tariffs across the board, what is going to happen is that some of these lesser developed economies will be the most worst hit, because they won't have capital inflows to the extent that they were having before, and on the other hand, the opportunities for trade are going to contract. uh, and as much as people talk about rising inequality, etc., fact is that globalization caused the largest point to point decrease in global poverty levels, and the largest reduction in regional disparity in terms of inequality. So to do a reversal of that would probably deny some of the lesser developed economies with the opportunity that were provided to the East Asian tigers, and obviously those are concerns that I think the global South needs to address together collectively, because no country alone can possibly push for freer trade, at least within democratic, rules based regime. So that's definitely something that we need to look forward to. uh, but broadly, I think that the concerns that this is going to be a major economic slump uh, is only partly true. Of course, the global economy is going to contract this financial year, but we need to also keep in mind that for 2 3 months, the supply was disrupted and the entire global economy was shut. If you ignore that 3 months of phase, then you see a very sharp normalization of economic activity, which happens over the next 6 to 8 months. Which kind of gives confidence that the next financial year would be more like business as normal approach than what is being predicted as of now. A key difference is, between the crisis that we saw post World War or the Great Depression, is that those recessions were a lot deeper and they lasted a lot longer. The difference is that this one is far more deeper, in the sense that of the crisis is much more swift. It will spread across the financial system and it will have a lot of volatility, but the duration of it is very short, in the sense that within 6 to 8 months we will be out of it. And I think that's the blessing in disguise, and I think that's something that really makes us very optimistic about global recovery. And one of the factors that makes us very optimistic also has to do with the way governments have responded. You see advanced economies give record stimulus, which is great. Then you see countries like Brazil, which have also given, a fiscally prudent yet adequate stimulus. Amongst emerging market economies, India has given one of the biggest stimulus. I think the average is around 3%, and India has given around 6, so it's nearly double. And this 6 obviously does not include the monetary part of this 20 trillion stimulus. So I think what we are witnessing right now is a level of cooperation by policymakers across the world, especially economic policymakers, whether it's central banks, whether it's the finance ministers, who are hell bent on preserving the financial system and its stability. And the key advantage of this is that they will limit the extent of the economic damage that we will witness. And that is very important, because this is a crisis that cannot be addressed, at least the economic crisis. In fact, even the health crisis cannot be addressed by a single country. It requires a collaborated, concentrated, and coordinated policy response to ensure that the financial flows continue to be as stable as possible, and currencies also continue to be as stable as possible. To a limited degree, I think central banks have been able to ensure that this happens, even though, as I said, that the dollar has appreciated, but that is a normal process that happens during every recession. So the key takeaway from this is that probably this time around the central banks have been more proactive in terms of preventing a crisis, and they have been more proactive compared to 2008, which is why we are witnessing that this economic stress has not spilled over to the financial system to the extent that it could have. Uh, and what really needs to be done, especially by economies in Southeast Asia, is to prevent bankruptcies as much as possible, to ensure that their companies can survive and that there is no long term impact of this pandemic. As long as we're able to do that, we should have a better next financial year. Obviously, IMF projects, based on their April numbers, that the next financial year would be a business as normal approach. Uh, and we do hope that that is the case. But a lot of it also depends on whether there is a second wave of this pandemic, or whether the virus mutates and comes back. So we don't really know exactly what is likely to happen on the health front. But what we do know is that at least on the economic front, we have started going back to the normal, and that normalization of economic activity is very important at this junction. And I think it's good that global economies are opening up. As long as we open up, but we remember that we don't have to close the doors that have allowed countries that were less developed to become developed. As long as those opportunities and those routes through trade are available, I see that COVID can cause a tectonic shift in the way supply chains are sort of built or created, and a lot of them would pass through countries like India, some South African countries, and middle basically South Asian countries such as Indonesia, Vietnam, etc. And that means that we will witness a more broad-based manufacturing process, which will create a lot more opportunities in these regions. And this could be a sort of takeoff moment for a lot of these economies if they are able to get their policy mix right. I think with that, probably I would like to conclude with what I wanted to say on the present situation as it is.
It's very nice presentation, very, very clear and very optimistic. Dr. Nimish Purohit is a practicing psychiatrist and assistant clinical professor of psychiatry at McMaster University in Toronto, Canada. He has seen a host of mental issues emerging in patients as a result of COVID among various sections of the communities. So it will be good to hear from him the first-hand information about what is happening in acute stage of COVID and what kind of mental issues or mental health issues are likely to emerge over the period of post-COVID. And let's see, Dr. Purohit, it's over to you now.
Before I would start, I would particularly like to thank Sambodhi Research Foundation to invite me to talk about this very important issue. And I would particularly like to thank Professor Subhash Hira. I've known Dr. Hira for a very long time, since my college days. And in my opinion, Dr. Hira has done much more for the community in general and medical community in particular. And I really admire his work, and I wish him all the best in his future endeavor. We are talking about a very important issue and quite dear to me. I've been a practicing psychiatrist here in Canada, but have worked in many different countries, including many different parts of Africa, Asia, in Europe, and Australia, New Zealand. And before we go any further, I think it's not all doom and gloom. It is important to realize that most of the people are actually quite resilient and will not succumb to psychopathology. I believe that some people actually will find new strength and even experience some sense of relief. I have my patients actually telling me that enough of running around and they would like to re-examine their lives. And I believe that society at large actually may also experience significant compassion or will come up with a lot of innovation. Look at this meeting today. We would not have been able to do anything like this before the pandemic. Because there is an urgency, a lot of new innovation is occurring. If you look at issues like climate change, people are becoming more hopeful now. There was a newspaper headline which says that the office is dead. I don't know whether that is true or not, but people have realized that there is no need to continue to work in an office setting because majority of the work can be done at home, and we might see actually less cars on the road. In terms of lockdown effect per se, in many countries, the lockdown came very suddenly. So at that time, before the lockdown came in, I think people did notice, especially there were some newspapers which were making some headlines. There was some medical journal, they were printing some articles about what was happening in Wuhan, China. Before the actual lockdown came in, although there was some kind of rumblings, I know that there was a denial not only at an individual level, but even at an institutional level. I remember that I was talking to a couple of my colleagues, and in fact, they were thinking that this is just going to be a glorified flu, because we had all gone through, especially in Canada, we had gone through that scare during the first SARS episode in 2003. And then the H1N1 flu came in. And at that time, somehow there was a magic bullet found. But unfortunately, this kind of denial did not serve the purpose in many countries. So what happened was that when the lockdown did occur, a reaction was similar to kind of a grief reaction, whereby there was complete shock and denial. People were becoming angry. and then slowly a bargaining captain that no, they'll be okay. We'll be locked down only for a period of time, and everything will be okay after. When they realized that no, that was not going to happen, then slowly the despair and fear started to creep in. During the mid phase of the lockdown in many countries, slowly but surely there was a lukewarm acceptance. The acceptance was not complete acceptance, but people are thinking that, well, what choices do we have? Because we are all in the same boat, or we are all in the same storm, so to speak. But underlying the kind of resentment was kicking in. Now, people have started seeing the late effects of the lockdown, whereby we have seen hopelessness. There's some kind of lockdown fatigue that is happening, whereby people were saying that this is enough. And some people would start to break rules or regulations whereby they were not observing the social distance. And this is the period of the time whereby there has been observation of frank psychotic behavior or manic behaviors. People have become violent, and there is a more risk of substance abuse, especially people using more and more nicotine, alcohol, and other drugs. The unfortunate part of the lockdown is that there is a destruction of social fabric, whereby there is an inability for a group of people to attend important, significant events in their life, be it birthday parties, marriages, or even funerals. And that led to a lot of different behaviors by different group of people. And unfortunately, that also led to stigmatizing certain group of individuals. Sometimes we heard the reports of certain healthcare professionals being stigmatized. We know that there's some elderly population that is being stigmatized. In Western countries, there are Asian people who are being stigmatized. And unfortunately, the social media, the conspiracy theories, and the so-called paid pundits did not help the situation. Now, when I say post-lockdown, I think the lockdown is ending in different countries at a different pace. We also know that lockdown per se that is opening up now is not actually a medical necessity, it's an economic necessity. And unfortunately, individuals may show lasting effects of prolonged stress. And although I'm quite heartened by the presentation that Dr. Bhasin had come up with, that there is some hope in terms of recovery, unfortunately, what is probably going to happen is that the financial virus, which has been circulating underneath the drama of this pandemic, there is a very good chance that generations to come may pay for it. And that may lead to a lot of unemployment, lot of economic hardships, and one would see lingering resentment and bitterness, which in turn will affect the productivity of our workers. And unfortunately, during the same time, we are likely to see more suicides. So I did say that this is not all doom and gloom, and many people are resilient. But we also need to realize that who are the people who will be most at risk in terms of developing all kind of mental health related problems. Well, one of the main group is healthcare providers. I say they are the main groups because unfortunately, we know from previous experience that healthcare providers are very good in giving very good advice to the population in general, but they have difficulty in following up their own advice. Majority of the research in the past has shown that healthcare providers are not good patients. There's a lot of stigma in terms of healthcare providers coming forward to seek mental health help. There's an embarrassment. And we know from the data that was presented to us previously, and we know from the previous emergencies, that a lot of suicides occur in healthcare providers. We have in fact seen some of the suicides occurring in US and even in China. And I do believe that there'll be increasing number of suicides in healthcare providers because at this particular time they are feeling lost. As a medical professional, the duty is that we would like to help people. Unfortunately, we are unable to help. There is no magic bullet. We really don't know what exactly is going to happen because there's a lot of uncertainty and moving parts. I also believe that people who have pre-existing mental health problems are the people who will be more at risk. People with multiple health problems. The other problem that in Western countries have is the nursing home residents, and especially in Ontario and Quebec in Canada, and in Seattle in US, we did see a number of cases occurring in nursing homes. And unfortunately, the relatives who lost their elderly relatives due to COVID were also at risk in terms of developing mental health problems. Newspaper Guardian had a wonderful article about 18 to 25 years age group, then developing later on mental health problems and lot of resentment because for them, this is their prime years. And people with disabilities, whether they are physical disability or intellectual disability, will be more at risk. It is unfortunate that even otherwise, there was a less and less spending in healthcare, more so in mental health. And unfortunately, we have not treated our brothers and sisters who suffer from disabilities. And I believe that these are the people who might suffer more during the post lockdown period. On 5th of May, Guardian ran an article about poverty kills. We know from experience that as we climb up in economic ladder, people's health actually improves. Even the current data has shown that the rate of death is more than double in people who are poor, especially people who are the lower socio-economic strata. So we now realize that this virus is a great equalizer. On one hand, there are a number of reasons, and my esteemed colleagues in economics and social work will be able to give you many different reasons why poverty kills. But we know that the equalizer virus will mean that we'll all be affected. So it will be important for different nations to really address the poverty and may even follow the examples of some of the other countries, including New Zealand or some provinces in Canada, to come up with a basic income support program. And it is important to address this poverty issue in the long run because it will affect all of us. We have identified some of the population. We have identified that these are the group of people who may be more at risk. So the idea is, what can we do? We know that there are some simple measures that one can take. One would like to establish and maintain routine. I actually tell my patients to make a schedule whereby they will follow each day to the point whereby they will decide what breakfast to cook, what lunch to have, what kind of social media they will spend time on, what kind of news outlet they are going to see, and taking care of their basic needs in terms of sleep, food, hydration. We also advise people to maintain active lifestyle. I know that this is not easy in many countries, whereby the living space is small. Secondly, the lockdown is so strict that you are unable to go out. But fortunately, internet has provided us with lot of useful resources in terms of maintaining an active lifestyle. And one can do simple exercise routine. And I tell my patients to actually vary their routine and make the schedule in such a way to stick it on the fridge and follow that rigidly. And we have seen the benefits not only for the adults, but for the children as well, who not only are doing the online schooling, but at the same time following this schedule to keep them healthy. It is also important to realize that alcohol is not going to help, neither the nicotine or the substances. They may provide you temporary relief from anxiety, but in the end, it will create more problems. We also know about doing meditation. I remember a few years ago, we were running a group for my clients who hail from the lower socioeconomic strata. And when we were talking about meditation, they were actually saying that meditation is for wealthy people. And when I asked them why, they said, well, you require a special room, you require special lighting, you require a very quiet room. And unfortunately, many people don't have that luxury. Then we came up that, in fact, why can't we make the meditation very practical, whereby the, the basic definition of mindfulness is trying to pay an attention to a particular activity at that point in time, and quite deliberately so. And by doing that, people slowly started to realize that they can build up on these activities and then create the gaps in their mind. And we know that at 15 to 20 minutes of these activity will actually show the benefits at a higher level. There has been a research from the York University which actually shows that the increase in the hippocampal area of the brain, which is the seat of basic positive emotions, can be shown on an fMRI scans. There are other simple techniques, including 4-7-8 breathing technique or 5-finger exercise. You just need to log in into the any website and will give you a very good idea about what it means. But basically 4-7-8 breathing exercise is a basic yogic technique. And Dr. Andrew Weil in the United States has made it more popular. And then very good videos being shared by him to allow people to de-stress and go into a better coping mechanism. The WHO Academy has put up a very good slides and very visual slide to capture some of the points that I was mentioning. And I'll not go through the whole list, but in general, it is important to realize that gratitude per se, meaning not just saying thank you for the sake of saying, but trying to help people in terms of truly feeling a sense of gratitude. And that has known to be a psychological immunity booster and has been shown up in many researches even conducted very recently. And I think it'll be a good idea for us to be truly thankful to what we have rather than complaining about what we don't have. Okay, so we have done that. What about people who plan these services? I think we know that the COVID cases are identified and sometimes even treated by the personnel with a minimal training or in fact no training in mental health at all. And that's why it will be very important that for the planners, for the assessment and intervention of psychological concerns be geared to this group of people. And they will need to address it at an organizational level, whereby education and training regarding psychological issues should be provided to healthcare leaders, first responders, and emergency staff. And I think the planners will have to ensure that there is a seamless liaison between medical resources in the community, in the hospital, or what resources available at an internet or at a web-based level. We all know that Italy was very badly affected, and the wave that came in was very sudden. There has been very good articles which has not been yet peer reviewed, but one of the main thing that they have identified is the first point. The mental health research has shown that identifying, developing, and disseminating evidence-based resources related to this disaster, by meaning that providing an accurate information that people can trust, was one of the main points that help people's mental health. And that's why one will need to identify those vulnerable populations. So then we can come up with an important area in terms of how we can liaise with other professionals. So we can quickly triage these patients and refer them for extra help. And I think the other important issue that has been noticed is that most of the time, the death notification is being given by the nurses or personal support workers. And as we have seen in many countries, that those people who are dying due to the virus were dying alone, and their loved ones were not allowed to go and visit them. And at that time, the majority of the burden is being carried by the nurses or the frontline workers. And I believe that they are the people who are showing signs of burning out. And I think it is important that we provide the help to this group of population to prevent any further burnout and developing unnecessary future frank psychiatric problems. I think the planners will have to anticipate the changing needs because still this is very uncertain. And that's why I think we need to prepare the planners to anticipate the changing needs. Okay, we identify the group of population. We know what simple measures to be taken. What about the role of professionals? Because I here try and advise the family physician in terms of what to do, what to expect. And I have told them that even people who are coming forward to you for help for their routine issues, I think it is very important that you don't shy away from asking leading questions about COVID-related anxiety and distress. Because many times people are embarrassed and they are not volunteering their anxiety. And I think it is important to normalize certain reactions, to let them know that it's okay to be angry within reason. It's okay to feel anxious within reason. And I think point to the commonality that not only we are in the same boat, but in a way we are all in the same storm, and continue to provide accurate information about community resources. Because there are resources out there are help out there, but unfortunately not proper information has been given and they rely on their family doctors to provide that information. I also advise them that we need to continue to reinforce the need for basic care, including sleep, nourishment, and showing that sense of gratitude. And I would briefly touch on role of medication. I I do know that although this is a complete new situation that we are all facing, the medications that we have to treat the anxiety, to treat the depression, to treat the psychosis, to treat the mania, are all very effective even at this time. And I think it is important to make a judicious use of these medications. I have seen that many physicians actually shy away from the use of benzodiazepines, for example. And I educate them that a proper and a judicious use of benzodiazepine at this point in time actually is extremely useful. I'll briefly talk about role of cannabis, which is very dear to me, and I know that many countries may not have get this legalized, but we have found that by using a particular strain of cannabis has not only helped people to deal with the current situation, but also allow them to develop the true level of acceptance, which I believe has prevented unnecessary use of many different medications. In summary, what's going to help us? I do believe that adaptability may be our best friend, not only during this COVID period, but even post-COVID period. And Washington Post recently highlighted what adaptability is all about. I think in general, there is a beautiful symbol of water comparing with adaptability. And I'm pretty sure that if you bring and picturize water, you will know what I mean when I say adaptability. In fact, people who are interested, just last weekend, the Spot Network released a video about Bruce Lee called Be Water. It's a documentary, which really gives you an idea what adaptability is all about. But in general, the adaptable people, that they experiment. They see opportunity where other people see failures. And most importantly, they ask for help. And I do believe that the most important reason is that adaptable people do not complain, they do not whine. And I believe that not only in terms of mental health, but generally speaking, people will need this particular quality to let them go through the next stage. And once again, I thank you to provide me with this opportunity. I wish all of you a good health. So be safe, be happy, and be healthy. Thank you.
Thank you, Dr. Purohit. I think it is an excellent presentation. I heard every word of what you said, and I'm sure that several thousand people who are connected on different platforms like the LinkedIn, the Facebook, as well as Twitter, they are also following very closely of what credible information is coming from a clinician who is day-to-day handling patients. Mr. Karan Bhasin talked about giving an optimistic presentation on what might happen in 6 to 8 months. And one question that has just come across is saying that how sure can the world be that yes, it is only few months or 1 year and not longer? That's positive. That's very, very positive, Mr. Bhasin, from what you are saying about the economic impact of COVID. The public health people like myself are not as positive about the flattening of the COVID curve yet in countries like Asia and Africa, and that is because of the herd immunity and the vaccine is all way far away. But the second point that you talked about, the tax reforms that India has included along with the stimulus packages, is a unique combination that you are saying, and if you can kindly elaborate on them to say that if these are tax reforms along with the stimulus package are actually producing some good results, then maybe other countries like in Africa and Asia and elsewhere can also incorporate those.
One very good parameter is, FDI inflows and the dollar reserves. A lot of emerging market economies have seen their reserves go down, and India is an exception because we have managed to buck that trend. So we have a current account surplus, our savings are going up, and both of these indicate a very strong macro sort of position, which means that we are not as vulnerable as say some other countries are. Say for instance, Latin America is the best example. They have macro fundamentals which are very weak. So in that context, the fact that we have taken reforms have prevented us from deteriorating our macro fundamentals. And of course, macro fundamentals don't really directly contribute, or they're not necessarily or necessary conditions for growth, but they are sufficient. They do assist in a swifter recovery, so they reduce volatility. And I'm a strong believer that the dollar has had its strong cycle for a while now, and subsequently at some point the value of dollar is also going to adjust, and it is going to come down to its fair value. So all of these factors will definitely ensure that we are much more comfortably placed, and a major part of it has to do with reforms, especially in the agricultural sector, because they are or the new electricity code that has been proposed. uh, I'll give you an example. A lot of people want companies from China to come to India, right? But one of the reasons that when you talk to these guys, they say that the electricity cost is too high. And this is, of course, while they ignore the land and labor issues, which again, land and labor were also addressed by some states. But they say that the electricity cost is too high. And what India did was the exact opposite of what East Asian countries did, in the sense that East Asian countries charge residential consumers a higher rate than industrial consumers, so they subsidize that to attract investment. In India, we did the exact opposite. So the new reform, once it's announced, once the law is enacted, aims to correct this bias, and I think that will definitely bring in more manufacturing jobs to India.
Very interesting, Mr. Bhasin. You are saying that the tax reforms as well as the um, economic stimulus that is being done and combined are very practical, and the economic indicators such as the balance of payment and the national reserves all at 484 billion have not been depleted at all. You are very right there, and so thank you. Dr. Purohit, there are two important questions that on mental health you want to address them, and this is like a sick patient with COVID, as is coming out, is then goes through social isolation. So it's a double whammy for a COVID patient, and then as he has to then be subjected to counseling, which again is defunct, and because of physical distancing. So lot has changed around that entire area of counseling, and with physical distancing, how do you do it? Virtual counseling from a long distance, and how do patients actually respond to these things?
I'm actually very thankful in terms of the questioners, because it brings up a couple of important issues, which in fact I had not addressed in the slide that were missing. The first issue that has been raised in the first question is not only dealing with children's mental health, but I think there's a real risk of domestic violence, especially during this lockdown period. And we have seen this happening towards women and children. Unfortunately, women and children in many developing countries, and even in developed countries, have been taking the brunt before. And now, when they are in a confined area, the irritability then increases, and that causes not only the pandemic causing the difficulty to the mental health of the women and children, but the effect of abuse actually compounding the effect even further. So, generally, in terms of dealing with the children's mental health and helping the parents to help the children, there will be a number of exercises which is available in animation form, or even simple exercise whereby the whole family would participate. Something like a Japanese technique that came out in terms of the five finger relaxation exercise. And a very simple thing, you can find the details on any good website, but the idea is that uh, help the children to have your two hands up and slowly do the breathing exercise whereby you breathe in when your finger moves up the thumb and exhale when the moves when you breathe out on the and move the finger down on the thumb, and similarly go on doing that with all five fingers. And the idea is very simple, that because you are using so many other senses at that time, not only talking to your children all the time, but your kinesthetic senses. You're actually seeing it and making it a game. And there are a number of other games that has been devised recently to help parents and the children to deal with the anxiety that the children are experiencing. The other thing is that, as we have advised to the parents, not to neglect the anxiety that the children are experiencing. I think it is very important to sit down and say that we are all in the same boat, and it's okay to say that it is okay to feel fearful. And the idea is that when you try and normalize the reaction, that decreases the level of anxiety for the children. The second question was about the employer thing, whereby I think what is going to happen is that even when things open up, as we know that there is a concept of presentism. So although people will be there at work, there's a very good chance that they will not be present fully. And that will affect the economic productivity in the future. And that's why it is very important for employers to actually address the mental health issues of their employees. And the best way to do that would be to open up, because many a times we have not really used the online platforms as best as we should to provide the important help that is needed. Here in our countries, we have opened up, for example, it was like a fortress that only a medical practitioner can provide the help, or only a trained psychologist can give the help. But we have opened up for social workers, for traditional healers, for people who do massage therapy. We will also just advise them online or on phone. Has allowed many people to come forward for help, and many volunteers centers have set up to provide that basic counseling needs. And I do believe that employers will be better advised to invest in their employees' health, especially mental health, by putting in more resources so the employees will be able to access that help as quickly as possible to not only prevent the burnout now, but in fact benefit that particular business to increase the productivity in the future.
Thank you, Dr. Purohit, for elaborating on mental health. Even before COVID, mental health was a major issue of public health importance, and the experts like yourself and psychologists and psychiatrists were in short supply. And now suddenly you have 8 billion people with complex mental health issues arising as a result of these new changes, and very little supply of experts. So I know we cannot address this now because we are running short of time in this session today. But as we come back in the second series, obviously we will spend more time on mental health as well as economic impact and see how we can make a difference. Thank you. So we move on to the closing session of this first webinar learning series that presented 7 webinars and were done by 23 global experts and was live attended by 250,000 viewers and over 500,000 footprints that came through during that 7 week period. So to do the honors of the concluding session, we have Mr. Santosh Gupta ji. He is CEO of Indian Social Responsibility Network, New Delhi, and he is going to give us the closing remarks as well as the futuristic vision of where do we go from here now.
As a part of global COVID-19 network, Sambodhi, University of Washington, and ISRN have surely been able to achieve the objective of creating a knowledge sharing platform across the world. The knowledge shared by the eminent speaker and experts is really valuable and definitely guide the rest of us cope up with the drastic situation of COVID-19. The eye-opening discussion enlightened as about the situation around the world, government efforts, as well as role of institution in preparedness, diagnostic, testing, treatment of COVID-19, challenges in fighting pandemic at country and global level, and many such topics that were part of the discussion. Some of the major suggestions throughout the series includes improvising epidemic policies based on infection rate in different states, scaling up emergency response mechanism, healthcare system, and frontline capacities. Also, we have discussed like setting up a national committee to fight COVID-19, importance of Ayush and Ayurveda. Collectivism is an individual manner to stand against Corona. So, my dear friends, these learning series have a huge impact on our awareness level and also brought a new light and points of action that can be planned and focused to be help out more people within a country as well as at global level. The global level exchange of events, experience, learning interventions have really expanded the horizon to view situation from new perspective and utilize the innovation intervention as per our context. Uh, Similarly, like if I would like to share one study of Statista using John Hopkins and World Bank data signifies that the extent of COVID-19 pandemic impact among countries where with the like Vietnam, you see the death ratio per million people. Like similarly, Taiwan 0.29 death per million people, as Malaysia 3.6 death per million people, Australia 4 death, only 4 death per million people, and also the Denmark 101.3 death per million people. So in views overall this study, if you see the India context, like India, though the increasing case still have a better situation, like only 2.8 fatality rate in now. So while the respective governments' handling of the situation can be worlds apart from the worst rated national COVID-19 response with like Spain, France, US, Mexico, and UK. So we can say like India response to COVID-19 led to national lockdown with a strict measure by Modi government. As our today speaker already said about the, especially Mr. Bhasin said, the behind the curtain, what the efforts has been put in by the government. So the planned measure enabled India to control the spread of virus according to its 1.3 billion population and also prepare for the coming situation. So the controlled measure at an early stage helped the government to equip hospital as well as health system, health workers, provide better healthcare services to tackle the situation of increasing cases. That is the reason why India has low mortality rate with control situation of that death. So another biggest role was addressing the citizen of India and creating awareness and appeal to follow the guidelines of lockdown. People highly obliged with rules in last 70 days of lockdown, which is another reason and achievement in itself. India has been doing better, like we know within 48.3% recovery rate. It's a very high recovery rate in comparison to other developed countries where healthcare system failed due to non-preparedness at initial stage. Though this series come to an end of participation from different countries, highlighting their practices and innovations. So it's a good thing, and Sambodhi has especially developed a micro website uh, that I will share the link of the website in the last the end of the session. Micro website for COVID-19 knowledge exchange, basically the knowledge exchange website, and all the resource material, PPTs, and various other documents related to COVID-19 will be available at the website. If anyone has a query, can ask our experts from there. The address for website will be also available on the ISRN website and the social media platforms. So you all, I would like to invite you to all, please come and see the website, and you can also share your comments, your knowledge, your expertise. So we will soon, as Dr. Hira said, we soon will be coming up with next knowledge and learning webinar series where we will have a community participation, those unsung heroes, practitioner, beneficiaries, and especially the Seva warriors, those are involved in social work, who were away from the light of media, was contributing in the fight against corona virus. Uh, they will be inviting and will be a part of the panel. Those who knows such heroes are one of them can send their name to share their on ground experience and learning. We will be shortly announce and share the date and details of the next series. So, lastly, I would like to thank our partner, Global COVID-19 Network partner like Sambodhi and University of Washington. Is Dr. Hira for well moderated session, Sambodhi and ISRN team for very well coordination and planning for smooth events. And most importantly, our participants, without whom the webinar series would not have been success. So thanks to all. And as parting words, I would just like to say that situation like this really required to uh, broaden our boundaries, stand in solidarity and collaborative action for fight against pandemic. We are in the together, and are we will win over this pandemic. I will everyone and their loved ones to be safe and healthy. Thank you to all, Dr. Hira. Now over to you.
Thank you, Santosh Gupta ji, for your words of encouragement and futuristic direction. We are very grateful to the collaborating partners, mainly the Indian Social Responsibility Network, as well as Sambodhi Research and Communication Organization and the University of Washington, Seattle, for coming together and putting all the efforts together to do this global COVID-19 network. We now are almost at the end, and Camilla, do you have any housekeeping announcements, please?
Thank you, Dr. Hira. I would just like to thank all of our participants for their continued attention, for their continued participation throughout our 7 weeks. Just before we conclude, I thought I would share with you some resources on the Global COVID-19 Network. This is our microsite, the link of which I will share. This is our online repository of all past webinar video recordings as well as summaries which you can access. I invite you to explore this. It's a very comprehensive resource. I will share the link with you shortly. I would also like to share a little article that Dr. Hira and I co-authored. This is a direct outcome of our webinar series. We wrote this based on learnings from our second webinar on epidemiology of the COVID-19 pandemic. I will also share the link with this, and I would like to thank you for your participation, and I look forward that if we continue this, then we would have your participation again as well. Thank you so much.
Thank you, Camilla, for your housekeeping announcements. And it's goodbye from all of us to all the participants who have been with us all along. And while during this break of a few weeks, you can be in touch with Sambodhi or with ISRN for whatever needs and comments you have while we are redesigning the second level series of webinars more directed towards community participation, and we will be seeing you soon enough. Till then, it's goodbye from all of us. Thank you.